Hello guys, myself Arshit. Today I'm going to tell you about the topic Marburg. So, firstly, let's start with the introduction. Marburg virus disease (MVD), formerly known as Marburg hemorrhagic fever, was firstly identified in 1967 during epidemics in Marburg and Frankfurt in Germany and Belgrade in the former Yugoslavia from importation of infected monkeys from Uganda. MVD is a severe and highly fatal disease caused by a virus from the same family as the one that causes Ebola virus disease. Yes, you heard the exactly right. It is caused by a virus from the same family as the one that causes Ebola virus disease. These viruses are among the most virulent pathogens known to infect humans. Both diseases are rare but have a capacity to cause dramatic outbreaks with high fatality. Now I am going to tell you about the history of Marburg. Illness caused by Marburg virus begins abruptly with severe headache and severe malaise. Many patients develop severe hemorrhagic manifestations between days 5 and 7, and fatal cases usually have some form of bleeding, often from multiple sites. Case fatality rates have varied greatly from 25% in the initial laboratory associated outbreak in 1967 to more than 80% in the Democratic Republic of Congo from 1998 to 2000 and the outbreak in Angola in 2005. So this is about the picture showing the spread of the Marburg disease. It is given death rates and infected alive with the dates. Virus was detected in the samples from the dead in Yugi and that and all. You can see the picture. Next, next is about general characteristics of Marburg. Order of Marburg is Mononegavirales. Family is Filoviridae. Genus Marburg virus. Species Marburg virus. Synonyms of Marburg virus is Marburg disease, Marburg hemorrhagic fever, African hemorrhagic fever, and green monkey disease. And interestingly, it has the same structural properties as the Ebola virus. You can see the picture. Next is about morphology of Marburg. Marburg is an enveloped, single-stranded, unsegmented, negative sense RNA virus. It has a filamentous structure, can appear shaped like A, U, A6 or spiral like a snail, and can sometimes be branched also. They tend to include long non-coding regions at the 3' end and 5' ends, which probably contributes the stability of the viral transcript. The viral fragment is pleomorphic, complex with proteins NP, VP35, VP30, and L. Next, this is about pathogenicity or toxicity. A rare severe hemorrhagic fever in humans and non-human primates characterized by a sudden onset with a high fever, chills, headache, myalgia, and maculopapular rash, possibly followed by vomiting, chest pain, sore throat, abdominal pain, and diarrhea even. Symptoms become increasingly severe and may include inflammation of the pancreas, jaundice, severe weight loss, delirium, shock, liver failure, massive hemorrhage, and multi organ dysfunction. Marburg disease has a fatality rate of approximately 25%. Now, about talking about the vector of Marburg. The natural reservoir for the virus is unknown. Epidemiologists have tested bats, monkeys, spiders, and ticks for the virus, but were not able to acquire the definitive data. Common factors indicate that the natural reservoir is a part of rural Africa. Okay, the secondary spread of the disease is via contact with the infected persons or contact with blood, secretions or excretions of infected persons. The virus may continue to be shed in the patient's semen for up to 3 to 4 months after illness. Sexual transmission of the disease did occur in the one instance in Germany. You can see the picture how contact. So next I'm going to tell you about mechanism. As with Ebola, the exact mechanism of Marburg is unknown. However, virion surface spikes are made solely of largely glycoprotein. It is presumed that, as with the other negative strand RNA viruses, these surface spikes bind to receptors on the host cell and mediate entry to the susceptible cells. The Marburg virus has 22 potential N-linked glycosylation sites on its surface. Viral replication takes place in the cytoplasm and envelope is the result of budding performed nucleocapsids. Systematically, the virus involves the liver, lymphoid organs, and kidneys. Incubation period usually 5 to 7 days but can range from 3 to 10 days. Now this picture is showing about how Ebola and Marburg viruses battle in the immune system. Symptoms of Marburg: fever or severe headache is one of the symptoms. Other symptoms are joint and muscle headaches, chills or weaknesses, nausea and vomiting, diarrhea, maybe bloody, red eyes, raised rash, chest pain and cough, stomach pain, severe weight loss, bleeding, usually from the eyes, and bruising. People near the death may bleed from other orifices also, such as ears, nose, and rectum. Now talking about diagnosis. For patients presenting with the Marburg symptoms, initial possible diagnosis can include malaria and typhoid fever. With Ebola, diagnosis of Marburg virus is confirmed with the IgG ELISA. Although IgM ELISA can be confused with the distinguished acute infections from old infections, IFA results can be misleading. Electron microscopy is useful in diagnosing filovirus infection but does not help distinguish Marburg from Ebola. Now talking about the laboratory findings include maculopapular rash, which is distinctive of Marburg, Ebola, dengue, and Lassa. Reduction in the number of lymphocytes, lymphopenia, and increased number of neutrophilic leukocytes, which is neutrophilia. The thrombocytopenia and abnormal platelet aggregation. Serum enzyme levels are elevated. EST is usually higher than ELT. Alkaline phosphates and bilirubin levels are usually normal or only mildly elevated. Marburg virus can be clearly diagnosed from specimens of deceased patients via immunohistochemistry, virus isolation, or PCR, which is polymerase chain reaction of blood or tissues. Treatment and finally the treatment and prevention. Supportive therapy: there is no specific treatment for Marburg hemorrhagic fever. However, the virus itself is sensitive to lipid solvents, detergents, commercial hypochlorite infectants, and phenolic disinfectants. The virus can also be destroyed by ultraviolet and gamma rays radiations. Vaccine: none. As the with exposure to the other filoviruses, exposure to Marburg does not confer subsequent immunity, and the antibody response in convalescent patients does not neutralize or protect against subsequent infection by Marburg virus. Thank you so much. That's all.